Osteoporosis, the silent thief. Have you ever felt like you've been robbed? This is exactly how this lady, this 75-year-old woman felt 25 years ago. But in fact, the robbing began very early in her life, after she was 30 years old. After she was 30 years old, there was a slow decline in her bone mineral density. However, she didn't recognize it until 30 to 40% of her bone loss was gone by the time she was 50. Today we're going to talk about osteoporosis. At the end of our lesson today, I would like you to meet these objectives. Explain the pathophysiology, signs, and symptoms of osteoporosis. Explain the risk factors of osteoporosis. I'd like for you to prepare a teaching plan on osteoporosis prevention, and then plan care for osteoporosis patient who will be returning home. So let's take a look and talk about the pathology of the bone. Well, the bone is very dynamic tissue. It's constantly going through changes. However, the changes, as long as they're balanced, everything is fine. The changes that I'm referring to is the osteoblasts, or the bone builders, the osteoclasts who remove old bone. What happens in osteoporosis is that the builders begin to slow down, or the osteoblasts slow down, and the osteoclasts continue to remove the old bone. So what's occurring here is that there's more removal than there's more builders. So what's happening is that osteoporosis sets in. Osteoporosis affects the trabecular bone as well as the cortical bone. Let's take a look at the picture here to the cross section of the vertebrae. Right over here we have normal bone, here we have osteoporosis bone. The cortical bone is the outside, or the compact bone. The inside is the trabecular, or the spongy bone. See what occurs in the next picture? It's a very thin line. You can hardly even see the cortical bone, but you also see how this has become more porous. The spongy bone becomes more porous. In our picture here we have a female age 40, 60, and 70. You see our 40-year-old who's standing upright. As she becomes 60 years old, you see where she loses some height. There's a slight kyphotic thoracic curvature there. Then look at when she turns 70. Look how there's a loss in height, a very prominent kyphosis in her thoracic area, as well as she leans forward. There's a little slight abdominal protrusion, which helps her with her balancing. So what happens with osteoporosis, again, as I mentioned, there's cortical and trabecular changes. However, the trabecular changes occur more quickly. Primarily we see that in the vertebrae of the spine. We see that from T8 through L3. There is a strong, it's going to decrease very rapidly. Microfractures can occur there. Other areas of the body that might be affected are going to be the distal ulna, okay, as well as the pelvis, and as well as the trochanter, primarily the head of the trochanter. Excuse me. So genetics and heredity play a large role in osteoporosis. So let's take a look here. Evidence suggests that genetics is a significant factor with 50 to 90% hereditability. So what that means is that if your mother or grandmother had osteoporosis, there's a very great chance that you also may suffer from osteoporosis. Additionally, there's been some common gene factors seen. So in vitamin D3 receptor gene, as well as in the calcitonin receptor gene, those have been found common in osteoporosis patients. There's been other research that have found other common gene receptors. Additionally, if you are Euro-American or Asian American, you're at increased risk of osteoporosis, as well as someone who is a thin, lean muscle mass. The diagnosis of osteoporosis occurs with a DEXA scan, which should be done by the time to develop a baseline at the age of 40. A score of negative 2.5 or less is indicative of osteoporosis, as we see here on this slide. Let's look at the osteoporosis risk factors. You can remember the acronym ACCESS. A is for alcohol consumption. Any more than 4 drinks a day can cause the bone builders to slow down and the removers to steep it up, causing at risk for osteoporosis. We have corticosteroid use. Those who are on long-term corticosteroids, such as asthma, lupus, rheumatoid arthritis, are at risk for osteoporosis. A low calcium. Calcium being low in the body, if someone has a low serum calcium, a signal is sent to the parathyroid gland to secrete the parathyroid hormone, which then works to pull the calcium out of the bone back into the bloodstream, and that puts someone at risk of osteoporosis. The next is the E for estrogen. Again, in postmenopausal women, a low estrogen puts someone at risk for osteoporosis. Testosterone, low testosterone in men also puts them at risk for osteoporosis. Then we have smoking. Smoking, again, works the same way as alcohol. It decreases the osteoblast, but increases the osteoclast in the bone, putting them at risk for osteoporosis. The next is sedentary lifestyle. Someone may just choose to be sedentary or a couch potato because that's what they want to do. However, some people may be immobile due to spinal cord injuries, and those would put someone at risk for osteoporosis. It's important to engage in weight-bearing activities which help build bone. Here's some signs and symptoms of our patient. Again, we see her again. We see a kyphosis posture, primarily in the thoracic area. We see she's probably shorter than she was 20 years ago. We also see her holding her back like she's in pain. Again, the pain usually resolves with rest. We additionally see she probably has a history of fractures. Let's take a look now at treatment and prevention of osteoporosis. There is no cure for osteoporosis, but however, the treatment and prevention are pretty much the same. Let's take a look at nutrition. It's important to consume adequate amounts of calcium and vitamin D. If someone cannot do that, they can take a supplement with a calcium supplement with vitamin D. Vitamin D can also be obtained with sunlight, because sunlight helps with the absorption of calcium. You can also limit carbonated beverages. Carbonated beverages, no more than 40 ounces per day should be consumed. Anything more than that, the phosphorus pulls the calcium out of the bone. Let's look at exercise. Engaging in weight-bearing exercises 3 to 5 times a week for 30 minutes is a good idea. Also with exercise, be careful and avoid falls. Again, let's look at healthy behaviors. No smoking, avoiding alcohol intake. Again, limiting caffeine, no more than 4 cups of coffee a day. And again, limit the falls, especially if someone's returning home. They want to be sure and have clear walkways, make sure the rooms are well lighted, remove throw rugs, avoid slippery surfaces or icy surfaces. Let's see how much information you've retained so far with our lecture today. Which of the following are an expected clinical finding suspect of a patient with osteoporosis? Select all that apply, and this is answering your objective 1 and 2. Okay, all of them are suspect except the person consuming 1 glass of wine a day. Remember, it's 3 alcoholic beverages a day, not just 1. Let's look at our next question, which covers objective number 2. Which of the following patients are at risk for osteoporosis? Select all that apply. Okay, everyone's at risk besides our 35-year-old who jogs 3 miles a day. Well, jogging is great, but if you have a long history of osteoporosis, jogging is something that you shouldn't want to do. For instance, myself, my mother has osteoporosis, so if I would try jogging at my age, I probably would cause a microfracture of my vertebrae. So it's important to keep those things in mind and educate patients about those things. Next question. Which information should be included in the teaching for an older adult who may be returning home? Select all that apply. This covers objective number 4. Okay, well, they should monitor all those things, and they should not walk on slippery surfaces. Even though someone is walking with caution, again, you don't want to take a chance of falling, because if someone who has osteoporosis falls and breaks a bone, chances are they may die in the next 6 months, because usually they'll break a hip or have a vertebral fracture, which can cause a lot more complications. Final question, objective number 3. What information would be included in a teaching plan to young adults about osteoporosis prevention? Let them know that there are modifiable risk factors to prevent osteoporosis. In conclusion, are you going to allow your patient to be robbed? Are you going to allow your patient to be a victim of osteoporosis? There are so many modifiable risk factors that we can teach the public about. As well as there are unmodifiable things. We can't change our genetics, we can't change our hereditary, we can't change our body structure or our sex. However, we can change our lifestyle. We can change our lifestyle. Avoiding alcohol, limiting caffeine, limiting carbonated beverages, exercising, increasing calcium in our diet. I think this says it best. Building strong bones as a young person may be the best defense against osteoporosis in later adulthood. Here are my references. If you could please complete your circle, square, triangle, and return that into my mailbox, and I'll see you next week. Thank you.